So I'll approach the scene and ensure the scene is safe. There's nothing here that can cause any harm to me or my patients. I'll draw the curtains to provide privacy and dignity for my patients. I'll do my hand hygiene according to WHO guidelines. I'll pour an ample amount of gel, palm to palm, palm over dorsum, palm over dorsum, fingers interlaced, fingers interlocked, fingers interlocked, rotation of the thumb, tips of the fingers, rotation of the wrist, rotation of the wrist. I'll allow my hands to dry for 30 seconds. Hello, good morning, or good afternoon, sorry. All right, my name is Benny. I'm your attending nurse today, and I'm here to administer your 1200 medication. Is it a good time, please? Great, thank you very much. Please, before I proceed, can I confirm your full name, date of birth, and if you are allergic to drug, food, latex, or adhesive, whilst I compare that with my paperwork and also with your wristband. Do you mind if I touch you, please? Thank you, please, okay? Your name is James Hartford, okay? Date of birth is what? 21st/03/1957, 21st/03/1957. Good. And your hospital number I can see is 570-321. 570-321. Perfect. And James, do you have any allergies, please? Ibuprofen and penicillin. Oh, okay, that's why I can see a red wristband. Okay, that's perfect. What reaction do you get, James? Oh, you get breathlessness and wheeze and anaphylaxis with penicillin. I'm so sorry about that. I want to assure you that throughout your stay in the hospital, we won't give you anything that contains penicillin and then ibuprofen. Is that correct? Is that okay with you? All right, thank you very much. How do you want me to address you, James? James is fine. Perfect. Great. Okay, so James, so like I mentioned, I'm here to administer your 1200 medication. Are you still happy for me to proceed, please? Perfect. Before I continue, please, can I find out from you, do you have any pain at all, please? Pain in your chest, okay? On a scale of 0 to 10, with 0 being no pain and 10 being the highest pain, where will you rate this pain? 5. Oh, I'm so sorry about that. Okay, assessor, on a normal clinical setting for a pain of 5 is a moderate pain. I would have to stop this assessment and then escalate it to the doctors and then, attend to my patients. However, for the sake of OSCE, can I please proceed? Thank you very much. So, James, have you had any analgesics for this pain? Oh no, sorry about that. Do you want me to reposition you? Maybe you can take in some deep breath. It will sort of help with the pain a bit, okay? You're right. Are you sure you'll be able to continue the procedure with me? All right, that's okay. Thank you very much. All right, so that's beautiful. So before I proceed, I would just want to go and assemble my drug trolley and equipment and come. Once I come, I'll read the drug chart with you and then I can dispense your medication with you. Is that okay? Great. All right, so before I go on, I just want to do some quick pre-checks with you. I want to find out with you from you, James. Do you have any difficulty in swallowing, please? No. All right, that's okay. Good. And I also want you to know that I'll be administering these drugs using the 6 rights of medication. Right patients, right drug, right dose, right documentation, right route, right date and time. Is that okay? Thank you very much. So I'll assemble my things and come back shortly to administer your medication. Is that okay? Good. So I'll leave the call bell with you. If you need me, please give me a shout. Just press on the call bell and I'll be right here. Okay? Good. Assessor, can you confirm whether my drug trolley has been locked, cleaned and not tampered with and is ready to use, please? Thank you very much. All right, so I'll bring my drug trolley to my patient bedside. All right. Hello, I am back. My dear, can you please confirm your full name, date of birth, and if you are allergic to drug, food, latex, or adhesive, whilst I compare that with my paperwork and also with your wristband, okay? All right, so your name is what? James Hartford, okay, date of birth 21/03/1957, 21/03/1957, good. And do you have any allergies, please? Ibuprofen and penicillin, okay, I can see the red wristband there. And what reaction do you get, please? Breathlessness and wheeze for ibuprofen and anaphylaxis for penicillin. Like I told you earlier, we will not give you anything that contains penicillin or ibuprofen. Is that okay? Thank you very much. Assessor, I can confirm that I am still with the right patient. All right, so James, like I mentioned, I have my drug trolley here and everything. Before then, I want to read the prescription and also dispense the medication as I go. Is that okay with you? Thank you very much. So I read the prescription. The surname is Hartford, the forename is James, the date of birth is 21st/03/1957, the hospital number is 570321, the ward is medical assessment unit, and the height is 1.57 meters, and the weight is 90 kilograms. The body surface area is 1.80 meters squared, and the consultant is Dr. P. Daisy. The time of admission is 7:30. James, can you confirm to me whether the height and the weight are correct, please? Good. Thank you very much. The prescriber's details are here. The name of the prescriber is Dr. P. Dazi. The GMC number is 32142113. The signature of the doctor has been appended here with bleep number 123. Good. Now the details of the person administering the medication is going to be me. Can you please permit me some few seconds? Let me document my name, okay? Thank you very much. So the details for the person administering, the name is Benny. The initials is BC, the signature, and the base is my ward, which is medical assessment unit. Good. All right. Thank you very much, James. All right. So at the allergy side, I can see that you are allergic to ibuprofen and penicillin, and you get breathlessness and wheeze from ibuprofen, and penicillin you get anaphylaxis, like you mentioned already. That's perfect. It's been acknowledged here, so you don't have a problem with that. I can also see that you have medication risk factor of diabetes. Is that correct, my dear? That's correct. All right, great. Thank you. Good. Assessor, quickly, I want to check the addressographs of all my pages to be sure if it bears my patient details, and then I will proceed. Good. Assessor, with the paperwork with me, I can confirm that all the addressographs bear my patient details, and I'm happy to proceed. All right. Now, on the next page, I can see, Assessor, I understand the medicine non-administration and self-administration codes, and I will be abiding by it. Okay, good. Now, for once only medication, I can see that you have today you had paracetamol. The dose is 1 gram, the route is oral, and the time required is 10:30. The prescriber's details is Dr. P. Dazi with bleep number 123. The time given was 10:30, and then it was given by R.N. Jones, and was pharmacy checked by C.G. Thomas. James, can you confirm to me whether you've received this paracetamol at 10:30 this morning? Good, you've had it. That's perfect. Good. All right, now I move on. I can see that you are not a CO2 retainer, and you have oxygen when required, and your target saturation is above 96%. Okay, so I can see that your starting device and flow rate is 1 to 4 liters of nasal prongs, and then it's been pharmacy checked by C.G. Thomas. The prescriber is Dr. P. Dazi with bleep number 123. The doctor's details and the signature has been appended here. That's good. But for now, Assessor, can you confirm my patient's last saturation level? 96. Good. So you are actually within the normal range, so you don't need this oxygen right now, so I'm happy to proceed. Okay, good. Now I move on to the next page. The next page has the antimicrobials. From the antimicrobials, for the first drug, I can see that you have flucloxacillin. The date is today. The dose is 500 milligram. The frequency is QD. The route is per oral. Duration is 5 days. The time is 6:00. The start date is today. The finish date is in 4 days. The prescriber's details and signature and bleep number has been appended, and this drug has been appended. The pharmacy check has been done by C.G. Thomas. I can confirm that this prescription is valid, it is legible, and it is correct. However, Assessor, I am not happy to administer this medication because my patient says he is allergic to penicillin, and flucloxacillin is a penicillin-based drug. So I am not going to give this medication. I am going to code it code 10 because my patient is allergic to it. Please give me a few minutes. Let me do the coding. So code 10, and then I'll write the date, and then I'll write my signature in the same box, and then quickly let me code it here before I forget. So the omitted doses, the date is here, the drug is flucloxacillin, the dose is 500 milligram, the route is per oral, and the reason for omission is code 10 into brackets, allergies. and then my signature is here. Good, thank you very much, James. I proceed. I can say that for antimicrobials, you don't have any other medication, so I'm happy to proceed. Now, for your regular medications, I can see that you have this drug here, irbesartan. The date is today. The dose is 150 milligram. The frequency is once daily. The route is per oral. The duration is 7 days. The start date is today. The finish date is in 6 days. The prescriber's signature and bleep number has been appended correctly, and the time to be administered is 12:00. It has been pharmacy checked by CG Thomas. I can confirm that this prescription is valid. It is legible and is correct, and I am happy to administer this medication. However, Assessor, can you confirm my patient's last blood pressure within the normal range? Good. So I am happy to administer this medication. All right. So quickly, I will open my drug chart, my drug trolley. So I will open my drug trolley with a key, and then I will expose the drugs. All right, good. Irbesartan. Okay, good. This is irbesartan. Okay, so James, this is irbesartan. It comes in 150 milligram. It's in an airtight container. Expiry date is 02/21/2026, and then it's in an airtight container. It's clean, intact, and in date. There's no problem with this medication. Irbesartan is an antihypertensive. The side effect is nausea and vomiting. The contraindication is hypotension. Are you still happy to take this medication, please? Good, you are happy. All right, so I'll be dispensing this drug using the non-touch technique. So I'll open this drug. It comes in 150 milligram, and your dose is 150 milligram. I can compare it, and it's the same drug, so I'm happy to dispense 1 tablet using the non-touch technique. Okay, 1 tablet gone there, and then I will close it. Good. So I'll set it aside. Lovely. So I'll put a dot here just so that I will know that I have administered this medication. I'll sign it later after you've taken the drug. Good. The next medication is levothyroxine. The date is today. The dose is 125 micrograms. The frequency is once daily. The route is per oral. The duration is 7 days. The start date is today. The finish date is in 6 days. Prescriber's signature and bleep number has been appended correctly. The time to be given is 12:00, and it has been pharmacy checked by CG Thomas. I can confirm that this prescription is valid, it is legible, and is correct, and I'm happy to administer this medication. Good. So the next drug is levothyroxine. So I have to look for levothyroxine. All right, good. This is levothyroxine. It's in an airtight container. It's clean, intact, and in date. Expiry date is 02/21/2026, and then the batch number is also there, 1, 2, 3, 4, 5. Good. This levothyroxine comes in 125 micrograms. So I am happy to dispense 1 tablet of this medication. James, this drug is levothyroxine. It is a drug used to correct hypothyroidism. The side effect of this medication is thyrotoxicosis and then tremors. Contraindication is hyperthyroidism. Are you thyroid storm? Sorry. Can you confirm whether you are still happy to take this medication, please? Good. All right. So I will be dispensing this medication using the non-touch technique. So I'll dispense 1 tablet. Good. And then I will cover my drug again. Good. Lovely. Now I move on. The next drug I see here is prednisolone. The date is today. The dose is 40 milligrams. The frequency is once daily. The route is not there. The duration is 7 days. The start date is today. The finish date is in 6 days. The prescriber's signature and bleep number has been appended. It has been pharmacy checked by CG Thomas, and the drug is due my time. Assessor, this prescription is not valid, it is not correct, and I am not happy to administer this medication because it lacks one of the 6 rights of medication. There's no route here. The route of administration is not here, so I am not happy to administer this medication. So I will be coding it code 6 as prescription is unclear. So I'll code it code 6. So I'll code 6, and then at the back I'll have to do it quickly before I forget. So the date is here, the drug is prednisolone, the dose is there, the route is not there, and I'm coding it code 6 because the route is not there, the signature is here. Good. So James, I'm not giving you this drug because there's a prescribing error here, so I am not happy to administer this medication to you. Good. Now I move on to your as required medication. I can see that you have paracetamol, and the date is today, the dose is 1 gram, the frequency is 4 to 6 hourly, the route is per oral, the duration is 7 days, the start date is today, the finish date is in 6 days. Prescriber's signature and bleep number has been appended, and it has been pharmacy checked by CG Thomas. This prescription is valid, it's legible, and it's clear, and I am happy to administer this medication. However, okay, first of all, your weight is 90 kilograms, which is above 50 kilograms. So I'm happy about this prescription because paracetamol needs to be given to a patient who has his or her weight should be above 50 kilograms, and you are 90 kilograms, so I'm happy about that. However, you mentioned that you had pain already. How is the pain on a scale of 0 to 10, James? It's still 5. Okay. Let me have a look. You have, I remember in your once daily, I think you were given paracetamol. Good, so you were given paracetamol around 10:30 a.m. and my drug round right now is 12:00, and paracetamol needs to be given 4 hours interval. So 10:30, 11:30, 12. James, this medication is prescribing is correct, it's due my time, I'm happy to administer, but because the medication was given to you like about 2 hours prior to this medication rounds, I cannot give you paracetamol now. However, I will not be coding it because it's a PRN medication. I will be escalating to the doctors about your pain level that is still high, and then they will prescribe another analgesic that doesn't contain paracetamol, and I'll be happy to come back and dispense that to you. Is that okay? All right, so that's the reason why I'm not giving you a paracetamol now. However, like I said, I will escalate and then ask the doctor to give you another analgesic that doesn't contain paracetamol, and I'll be here to administer it to you. Is that okay? Thank you very much. Good, so there's no other drug here. Now I can also see that for your infusion side, you had 0.9% normal saline. The volume is 500 mils and it was intravenous. The duration is 4 hours. The prescriber's signature has been appended here, Dr. P. Darcy. Pharmacy checked by C.G. Thomas. It was given by R.N. Jones and it was double checked by R.N. Angela. The start date was start time was 7:30. The stop time was 11:30, and 500 mils of normal saline was given. Can you confirm to me, James, whether you've had this infusion being given to you already? You've had it, yeah? Good, great. And I can see that currently you have normal saline 0.9, volume 500 mils. The route is IV. The duration is 4 hours. The prescriber's details is here, Dr. P. Darcy, and then it has been pharmacy checked by C.G. Thomas. It was given by R.N. Jones and double checked by R.N. Angela. The start time was 11:00 and the stop time is not there because I can see that the infusion is still running. Okay, that's perfect. Quickly, I want to assess the infusion bag. I can see that it's running, that it's dripping well. The bag, the expiry date is in date. The batch number is also in date. That's how I'm happy about that. I can also see that there's no cloudiness in the bag. There's no precipitation. There's no bubbles, and so that is also very good. And the line is the fluid is dripping well. Can I assess your cannula site? Do you have any pain around the cannula site, James? No. Okay. Assessor, can you confirm my patient's last temperature, please? Within a normal range. Okay. So, James, I'm touching your cannula side. Do you feel any pain around here? All right, good. And I can see that the area around the cannula is healthy, and I'm happy to proceed. That's really good. So I am happy about that. Good. So James, quickly, I want to administer your medication. So this is your ibisatan, this is your levothyroxine and all. And would you like to take your medication with water or with squash? With water. All right, good. So yeah, would you like to take your medication one after the other, or you want all at once? One after the other. Okay, so that's your water. All right, you can have this one. Take it for me. Good. Can you please take this one as well? Good. Thank you very much. All right. Can I confirm whether you've taken your medication? Open your mouth if you don't mind, please. Good. Great. As I said, I can confirm that my patient has taken the medications, so I am happy to document. Just give me a few seconds. Let me document the medication that I have given, okay? All right. So I'm going to sign for ibisatan, and then I'm going to sign the date and my signature for levothyroxine. And then all my coding has been done. Good. Let me double check it. Good. All right. So James, because it's a medication, I will be staying with you for the next 30 minutes to monitor the effectiveness of the medication or any side effect that may arise. Okay. All right. So if there's any problem, just let me know. However, do you have any concerns for me? Anything you want me to know about? No, that's all right. Good. So if there's nothing, I will make sure that the environment is safe. My drug trolley is locked and the key is kept safe with me. It's locked and key is kept safe. Everything is okay, and I'll make everything here ready for the next use. There's nothing here that can cause any harm to you or my patient. So I will leave the call bell with you just in case you need any assistance with anything. Just use your call bell. Is that okay? Thank you very much. And like I said about the pain, I will talk to the doctors about it. Okay? If there's no concern or anything, I will do my final hand hygiene. I'll pour an ample amount of gel, palm to palm, palm over dorsum, palm over dorsum, fingers interlaced, fingers interlocked, rotation of the thumb, tips of the fingers, rotation of the wrist. I'll allow my hand to dry for 30 seconds. Thank you very much, James. I'll see you again later. Bye-bye.